The Honourable Annette King.
Thank you, Mr. Speaker. My question is to the Minister of Health. Will he make good on the promises he made on radio yesterday to Canterbury District Health Board that, quote, if they need more money for mental health this year, they need to tell me exactly what they need, because the government is listening?
Speaker.
The Honourable Peseta Lotu-Iiga.
On behalf of the Minister, yes.
Supplementary question, Mr. Speaker.
Supplementary question, the Honourable Annette King.
Who indicated to Canterbury DHB that for the 2016-17 financial year they could expect to receive $10 less per head of population, as stated in the very document he quoted from in the House on Tuesday, to justify his view they already had sufficient funding?
The Honourable
Mr. Speaker. Mr. Speaker, I don't know who that person is, but what I can say is that Canterbury District Health Board spent around $147 million on mental health services, and that's an extra $23 million compared to 7 years ago.
Question, Mr. Speaker.
Supplementary question, the Honourable Annette King.
Is he not aware that Canterbury DHB were forced by demand for mental health services to spend $8 million more than the ring-fence mental health funding provided? And perhaps a lack of awareness might account for the plight Cantabrians now face, because ignorance is not a defence.
The Honourable Peseta Lotu-Iiga.
Well, Mr. Speaker, in this House, that member has come up with some pretty dodgy figures in the past, sir. And what I will say, and I'll reiterate to that member, is that there has been an increase, a vast increase in the amount of mental health services funded. Sir, in December just of last year, an extra $16 million was given to the board so that they can address some of the mental health services that have been requested.
Point of order, the Honourable Annette
Mr. Speaker, I seek leave to table the PricewaterhouseCoopers report commissioned by the Ministry of Health, dated the 2nd of December 2015, page 11, saying they spent $11 more.
Order. Member now will resume her seat. I just want to check whether it's a report that's available publicly to me.
Not readily, Mr.
Then
Speaker.
I will put the lever sought to table that particular PwC report. Is there any objection? There is none. It can be tabled.
Supplementary question.
Supplementary question, the Honourable Annette King.
When will he make good on the promise to give Canterbury DHB more money if they, quote, need it, in light of the fact they have already asked and been refused, that he said on Tuesday in this House they had ample to cover mental health demand, and that he is poorly informed about ring-fence funding, deficit support and even the amount provided?
The Honourable Peseta Lotu-Iiga.
Well, Mr. Speaker, it's rich coming from that member around deficit support, when $150 million in deficits were left by that minister to this government. But, sir, to answer the question...
Order. Point of order, the Honourable Annette King.
Speaker, point of order. We have had 3 answers. The whole 3 have been abuse thrown at me and not answering the questions.
No, I don't agree with that first part of that. The difficulty I have, if it's a nice simple question like when will he make good on the promises, I can help it. But when the question went on considerably more than that, then it's very easy for the minister just to address it in any way he likes. If I can get the minister to sharpen up her supplementary questions, then I might be in a position to help her. Order. The member will rise and simply ask a supplementary question. I know she
Point
was
of order,
responding.
Mr. Speaker.
Point of order, the Honourable Annette.
Point of order, Mr. Speaker. I responded to an interjection. Are you going to ask that member not to interject?
No, I'm not. But before you responded to that interjection, you also interjected and criticised me as you rose to your feet. Simply rise and ask your supplementary question.
Supplementary question.
The Honourable Annette.
Has the Ministry of Health told him that the Director of Mental Health, who he said is going down to Christchurch on Friday to talk to the people on the ground, is the same director who said, quote, the Ministry of Health does not consider there is justification to provide additional funding to Canterbury DHB?
The Honourable Peseta, Sam Lotu-Iiga.
Again, on behalf of the Minister, yes, the Director of Mental Health, Dr Crawshaw, is in discussions with the District Health Board, as well as other agencies, to identify whether any further assistance is required on the ground in Christchurch.
Speaker.
Point of order, the Honourable Annette.
I seek leave to table the aid memoir to the Minister, dated the 17th of March, from John Crawshaw, saying they did not require additional funding.
We don't need to know what's in it. I just need to now put the levers to the aid memoir. Lever sought to table that particular paper. Is there any objection? There is none.
Supplementary question.
Supplementary question.
Will he take up the challenge, Mr. Speaker? Yes, there is. Oh, you're allowing interjections
I didn't
across
hear the interjection.
Well, I
If
heard.
the member wants to ask her supplementary question, she can do so. Supplementary
to, Mr.
question, the
Speaker.
Honourable Annette King.
Will he take up the challenges put to him in the press editorial yesterday, and where it said the situation of mental health in Canterbury was disgraceful and distressing, and ask what does it take for the scale of mental health issues to be recognised in Wellington?
The Honourable Peseta, Sam Lotu-Iiga.
Sorry, can you repeat that and repeat that question? Sorry, I just missed the last bit.
Order. Order. If the member wouldn't mind repeating the question.
I don't mind
the
at
House
all,
would be
Mr.
grateful.
Speaker. Will he take up the challenges put to him in the press editorial yesterday, where it said the situation of mental health in Canterbury was disgraceful and distressing, and asked what does it take for the scale of mental health issues to be recognised in Wellington?
The Honourable Peseta, Sam Lotu-Iiga.
Well, Mr. Speaker, as I've already said to the member, the Director of Mental Health will be having negotiations and discussions with not just the District Health Board, but other agencies to get a sense of the scale of the need for Cantabrians for extra resources. Until we hear about those discussions, we can't make any further, make further decisions.
Order. Order. Question number 3.